Yes, welcome our viewers tonight. This is Workers TV. Today I'm very privileged to be having one gent and one lady on tonight's show. Before we go ahead, I will just beg them to kindly introduce themselves. I begin on my left side. There's one sister in the names of Annette Birungi from Uganda Nurses and Midwives Union. Hello, madam. You are very welcome on tonight's program.
Yes, good evening, viewers. I'm going to ask to remove my mask so that the viewers can listen to me. My name is Birungi Annette, National Treasurer against and Midwives Union. I'm also Secretary for Women, National Organization of Trade Unions.
Welcome, Madam Annette. On my right, there is a gentleman in the names of Tumusime Vincent. You are very welcome to tonight's program.
Thank you very much. As said, my name is Vincent Musime. I'm the project officer, Uganda Nurses and Midwives Union. I'm happy to be here tonight.
Welcome. Yes, our viewers, we are going to discuss the COVID-19 pandemic. We all know up to date from March, we are still struggling with the pandemic. And I have brought in these two experts to continue digging deeper in what COVID-19 means to the country Uganda and how we are trying to solve it. Let me begin with Mr. Tumusime. COVID-19 came in Uganda as early as March. We are in August. We are in July, rather. How has the journey been in terms of, I know midwives and nurses are on the front line. How have you found the job?
Yeah. Thank you very much. COVID-19 in Uganda came in March, but it did not begin in March. It began as far as December 2019, of course from Wuhan, China. We shall not call it Chinese virus as other people have called it. But we thought at first it was a European thing and the Asian thing, but finally it came to Uganda. When it reached here, there was a lot of panic. Everybody was in panic, including the health workers. Of course, the health workers at this time were the soldiers on the front line, putting on uniform to fight the disease. They were in panic. They didn't know this was a new disease. They didn't know what they were going to do. However, there were a lot of information that was circulating from World Health Organization, our government, Ministry of Health, and so on, including the president. He took a lead. He appeared on TV and gave guidelines, of course, from experts. But most important, the fear that engulfed nurses and midwives was very much. But this did not make us wither. People they went on the front line and they fought the disease. You realize that the first days of the disease, it's as if it was not all that, in terms of progress, it was not all that serious. It was catching ordinary citizens. But then, around May, it started affecting health workers. We first got the news of the first one. The number increased to 8. All of a sudden, it increased to 27 in less than a week. Every health worker was scared. People were calling us saying that they are putting down tools. People were complaining they didn't have what to use in the wards. Now they started realizing exactly what COVID was. They knew that it was with them and it was going to catch them. That's when we started feeling the impact that indeed it is not just affecting ordinary people, but it is also affecting us. So the efforts you are seeing today is because of the fact that COVID started affecting health workers. But so far, we are still managing and we are still struggling.
Yes, as you did right say, COVID started affecting even health workers. To now, we have seen very few cases recorded in terms of being positive. Very few health workers have tested positive. What that extra mile are you going? Have you put in place to see that at least these frontliners are safe from the disease?
Thank you very much. I've told you I'm a project officer of Uganda Nurses and Midwives Union. When this came, the team at the Secretariat, the President, the General Secretary, the Treasurer, we sat and said, no, this can't happen. We must fight it. So we started looking for support from friends, from government. Sister Annette was even on the lead. She moved to government, moved to Ministry of Health. They were saying, they were looking at it as a minor issue. They were brushing it off. So when we realized that our own domestic efforts to nurses were not becoming positive, we are not yielding in favor of the nurses, we decided to look for support from abroad, from our friends, and by God's grace we got support from the Danish Trade Union Development Agency, DTDA. Now, these gave us support to go and provide mentorship, psychosocial support, and provide PPEs to health workers, which we did. We developed materials. We have been moving in all health workers. We have in all health centers. We have already gone to districts like Nakaseke, Ruwero, Kayunga, Buyikwe. We have gone to Akiso, Mpiji, and we are rolling up. We are rolling up to many more districts. We are providing healthcare support to our health workers. We are giving them PPEs because we realized that the government in some instances was not providing enough. We would find some health workers we are being given, we are being told go and improvise. But how do you improvise under circumstances of COVID? COVID, which has made everybody get scared, including the president of one of the most powerful countries, Trump, is scared. How do you tell a health worker or a nurse that just to go and improvise? So we provided things like sanitizers, face masks, surgical in this case, and we provided them with guidance, counseling, and also advised them on how to protect and prevent them and protect themselves against COVID. That's why you are seeing that as of today, there is the curve, as they have been saying, the curve of COVID among health workers is actually going down. It's because of our efforts.
Do our people really believe COVID is with us?
The common people or the health workers?
The common people.
Those ones who have not got it, perhaps they believe it might not be there, but I cannot take the stand of the common people. I would give my personal view. COVID is there. COVID is real. If you don't protect yourselves, it will catch you and perhaps it will kill you. Because you cannot tell that people in Italy were dying of a mysterious disease. No, it is COVID. People in America have died in numbers, in China. All these countries, we are just lucky that we have not lost any health worker, or we have not lost any person in Uganda.
Thank you, Mr. Vincent Tumusimi. Let's get to Madam Annette Birungi. I know you are the National Treasurer for Uganda Nurses and Midwives Union. How have you managed this situation?
Viewers outside there, it is very stressful, of course, but we as nurses of Uganda, we have tried hard to be on front line. And to talk about Uganda Nurses and Midwives Union, it is a workers' body that safeguards its members against any threat at workplace. So we look at safety so much and workers' rights. So when this disease came, of course it brought some panic, but like how the project officer has told you, we have tried hard to approach organizations that have been fighting COVID-19 spread, and including our own government. Through Ministry of Health, we have written proposals. We have also gone ahead to write other concepts abroad until when we landed on the Danish nurses. But for us as nurses, we are managing because we are the people on the front line. While everyone was at home during the curfew and all that time, when it was really stressful, in that crisis, the nurses remained on the front line.
Can you briefly give us some of the concepts you have developed or some strategies you have put in place to ensure that as a country we get out through this possibly very positively?
We have done a lot of sensitization as Uganda Nurses and Midwives Union. We have also gone ahead to supervise to see really these nurses, are they really protected or they don't have protective gear? And we have found out that the protective gears are not enough. We have tried to do psychosocial support, like as they have told you. We have tried to sensitize the community, because you know, if you don't sensitize the community also, they will also bring the disease to you. So as nurses, we have gone ahead to sensitize the community. In most health centers, you find that when they are through this program, after nurses now getting sensitized and they have the knowledge, they cannot even start work without doing what? Sensitizing the people who have come to attend the clinics. Because they know some of them want to come without what? Without washing hands. They want to come in without masking themselves. So we have tried hard to see that we extend knowledge about.
A few weeks ago, we did see it was a fact in the press, nurses and midwives complaining about their payments. They're coming in very late, some are still very small, some are not even getting them on top of the PPEs, that they are not enough. At a certain point, do you think government has not played its role, especially the Ministry of Health?
The government has done some work, I can say, because you see, this is when it came. We were not prepared for it. But information has not reached on the grassroots. More so, the personal protective equipment, they are not enough. In fact, they looked so much on the people who are directly for the patients, than the people who are receiving what? The patients. This has been stressing nurses so much, because you see, when a person is being assessed, yes, it is true there are thermometers, but some people have no temperature. So the government has provided these thermometers in some areas, and in some areas they are not there, because they really think that in some areas there is no COVID-19. But remember, even in those areas where COVID-19 affected, it is you cannot know that it is going to come there tomorrow. So I don't think we have done much, but we are, as a government, it has tried its level best. But there are still a lot of complaints, like those delays of the money, which is allowances. Those allowances, in other countries they have risk allowances, but for us we don't have. And in some areas, at first when the disease came, we started staying near the hospitals. Those who were caring for for the patients. But now it would cause a very big gap when those allowances are not given, and you are going back for your offs without those allowances. And some nurses have been having some small outside businesses which were also affected. So during this time, there have been a lot of poverty. Some nurses have been affected. They've been, like, economically they have not been okay. And socially, they have also not been okay, because the community itself, take an example of some of the nurses who are not housed by government, and when they go, they find that the neighbors are even distancing themselves, saying that, I don't want the children of so and so to come to my what? And also the nurse herself or himself is not tested after work. So we also fear that maybe our children, we are going to affect them, because they come directly to hug us.
Madam, let me get this clearly, Madam Annette, sorry. Yeah. You said the nurses, these frontliners, are not tested. Is it true?
Now, the testing was not done immediately. And even up to now, they only test you when you have signs and symptoms. That's what is happening, because of few kits to use. So, and you know, it also extends further to the people who receive the clients. Remember, this client is not also tested. If the client has signs and symptoms, the results will come after 72 hours. what happens to the clients also, to the patients, also happens to what?
The doctors.
To the doctors and nurses, because it's only when you get signs and symptoms that you will be tested.
There's a question in the public that yes, COVID-19 came in and abruptly no one was prepared for it. Then we have focused much on COVID-19, putting aside the other diseases. How are you managing these other cases? Like we have pregnant mothers, measles and other diseases.
I think our offices are in Mulago here, National Referral Hospital. But a few cases we have visited, for 3 months, the first 3 months, most of the outpatients, they were not working. They were closed. But today they are open and people are coming. After opening, they want the transport. And the reason for that, why they were closed, it was because some health workers stay far and they could not come and work. There was a problem of transport. Good enough, some of the people were also not going to the hospital. So I have to say that most people really suffered during that time. I cannot say that they did not suffer, because I personally visited some of these health centers, some of these outpatient departments which were closed for some time. But today they are open.
Thank you, Madam Annette. Let me get back to Mr. Tumusime Vincent. Now that COVID is going to stay with us for some good time, as Uganda Midwives and Nurses Association, rather Uganda Nurses and Midwives Union, what interventions are you putting in place to ensure that we can at least stay with this COVID-19, but it will not do harm to us?
Thank you very much. Our main target now is to ensure that we sensitize, first of all, health workers to remain safe. Because there is no way you can protect a person when you are not protected yourself. So we want to protect health workers by sensitizing them such that they can transit this message to the patients. The patients I'm talking about are not the COVID-19 patients only. These patients who come to the hospital, keep social distance. We are saying wash hands. We are saying put on masks. We are telling them that these are the basics of how you can protect yourself against COVID. Then, of course, is to encourage the public to ensure that they take on these measures. They don't look at them as if they are the presidential measures, they are LDU measures, and so on. These measures are very paramount. We should take them on, keep a distance, wash your hands wherever you can, wash and wash them carefully, not just pour water on your hands and you walk away. We are saying, where possible, apply a sanitizer. If you can get a sanitizer, apply it. And we have been having, I think I have, like this that we have been giving to our nurses. If a nurse has this and it gets finished, she can add in, keeping it in your pocket. Because these things are being provided today because we are aware that this COVID might not go away. So people should get used to living with them, washing hands, have jerry cans at your house with water and soap, put on masks. You might not need these expensive masks, for example, for a common person. Just go and get a cloth masks, as you have been told by health workers, those ones which are standard, put them on. And then, of course, avoid being in places where you are not supposed to be. For example, if you find it is a gathering where you are not invited, why should you be there? Avoid those places. The basic issue is protection. If you protect ourselves, COVID, even if it remains here for the next 10 years, you can still remain alive. But if you don't protect yourself, even if it goes within a month, within that 1 month, you'll have caught it, because it takes just seconds for you to get it. If I cough and I have it, you'll sneeze it. Just in microseconds, you'll sneeze in. And once you sneeze in, you'll have got it. Meaning that me who has cough, I should not be near a person, I should be very far. If I want to spit, I should spit not in a public. We know there are those, what we call in science, reflex actions. Actions which you don't control, but then protect yourself. For example, touching your face. You see, when you have a mask on and you are going to touch yourself, your hands will land on a mask. So basically the issue is, if COVID is to stay here, we need to protect ourselves against it. We don't need to run away from it. Running away is not a solution. The issue is, let's protect ourselves. I've been seeing people boarding, going to the village, saying that they are running away from COVID. Even if you board from Kampala and go to the village, and you in the same bus where you have moved, you move with the person who has COVID and get it. Just the basic issue is, if you are entering a bus, wash your hands. Measure the temperature of the person who is going into the public. So I may only say government should help us the way we are trying to help them, because this is a cardinal role of government. The role of government is to provide a common good, social services, basic services, protect the citizen. Now, the way we are helping government, it should also help us, reinforce us. Where necessary, give us funds. Why should we go to look for funds from the Danish people? Yet we have funds here. They should give us funds. We do this job so that people can live. Even if COVID is to stay here, we live with it, and we live, and we survive. That's the best.
Amidst all these challenges, what an assurance are you giving to the country that as health workers, you are ready and fit for this job?
We have already done it. Since COVID came, it was reported in Uganda, the first lockdown was on 21st of March. Today is, we are moving really. You are seeing we are already going into, we are finishing 3 months. In the course of with COVID, we have not lost anybody. As of today, I believe if the ministry was to give standard figures, we have less than 200 people who are bedridden, who are in the wards with COVID. This means that health workers have done a great job. Actually, they should be congratulated. When you meet a nurse, you should stand and salute the way you meet a soldier and you meet him and salute. People should be thanking health workers for what they have done. The health workers are much more competent. Actually, people who think that Uganda has unqualified health workers and qualified professionals, the truth of the matter is we have qualified professionals. The only challenge we have is that sometimes we are given less to do something big. We are given less resources to do something big. Then those ones who are doing nothing, you give them a lot.
Thank you, Mr. Tumsimbe. As we wind up, let me get back to Sister Annette Birungi. Yes, now that COVID came in, you have helped us, nurses and midwives. Do you think this is the right time to call upon government to at least raise the salaries of all people who are on the front line?
That is a very good question, my brother, because work that is not rewarded, it has no production. Because when you reward me, it means that I will really work hard, and the employer will receive what? The results, the good results that are positive. Yes, for us health workers, especially nurses and midwives, we know that way back, the history of a nurse, the person Nightingale who started nursing, really started it without any work, without any salary. But today, you know the challenges that are on. If you increase salary to the health worker, and the health worker is able to meet the needs, the essential needs, it is perfect. So I support your point when you say, do you think
this is the time?
This is the time. For me, on behalf of the union, salary increment is a way. It was even supposed to be increased immediately when the COVID-19 came, because it is very, very important that people live in a very good environment, people live without stress, because right now most health workers are now looking at, after this pandemic disease and the children are going back to school, we have not saved anything. What are we going to use to pay the school fees? There are so many challenges. So we beg government, we really request that the government should increase our salary.
Your closing remarks as we wind up the show?
My closing remarks to the viewers outside there, COVID-19 is still there and it is not going today. Therefore, we request the people in this country, Uganda, to practice social distancing, and it should be part of them. They should avoid going into public places unnecessarily, and more so without what? Masks. Washing hands, thoroughly, even for 20 minutes over. It is very important with soap and water. And for the nurses, because this sensitization is particular to the nurses, I want to add those basics that we are supposed to sanitize or to disinfect all surfaces, because including the handles, the trolleys, wherever we touch all the time, we need to continue disinfecting and sanitizing. And wearing masks, it should be a routine. Sensitization of the public, that is, we should include the health talks of COVID-19 every morning as our health education. Because if we have the disease, if they have the disease, it means we are more stressful. And therefore, let us work together and thank the Danida, the Danish Development Agency, which has been able to come in and give us these funds for us to sensitize the community of nurses, because we were really handicapped. We were like, what can we do for our health workers? But we've been able at least to get funds from the union, buy a van, which we are using currently to move. Then the fuel is also provided by the what? By the donor, and they have given us the money to also come up with this tool, a tool kit for protecting health workers against COVID-19 and others. So we've been sensitizing the community on this tool, and therefore let us stay safe, stay preventing the disease.
Thank you, Madam Birungi. Let's wind up with Mr. Tumusime. Your closing remarks to our viewers tonight.
My closing remarks. One is the health workers. Protect yourself before you protect others. If you are not protected, don't protect others. First, protect yourself. The country still needs you in this battle and other battles which we don't know that might come. Corpses and dead bodies don't treat people. It's only the living. To government, I request government to think very much deeply on how to support the health systems. Government, the truth of the matter is, most of the money, you release money, by the time it reaches the health, the final destination, the hands that have received it, or the channels that it has taken, there, if it was to reach, the percentage is very, very small. Put much more checkers and provide much more tools to protect the health workers. To the general population, I cannot say that you stay home, since they have already started saying that we should go. But when you are going, ensure that you are safe. Don't be in a place where you are not going to be safe. Don't mix with people. Don't put on face masks. Sanitize yourself, and so on. If you find that you are reaching in a place where you suspect that these people are not protecting, are not going to provide you protection, don't go to that place. Finally, the funders, that is to our funders, that is Danish Trade Union Development Agency, thank you very much. We pray that God rewards you with more resources and you help us the more. Ugandans still need more help. We just moved in 6 districts. Uganda has 137 districts. This is less than even 5%. So we are praying that God rewards you with more resources and you help us the more. But thank you very much for the good heart and for the good work. We have really done what we were expecting to do. Otherwise, may the good Lord bless everybody and keep us safe and alive.
Amen. Yes, our viewers, that brings us to the end of tonight's show. It has been my privilege to host the two, one gent and one lady, for this program. We have been discussing the COVID-19 pandemic, and therefore it is incumbent upon our public members, especially Ugandans, that please sanitize where possible, wash your hands where necessary, and if possible, stay at home. This is Robert Onyango, and this is Workers TV. Meet you another day.
Thank you.